Good evening, and thank you for joining tonight's live town hall hosted by Douglas County. Did you know there are more than 1,300 retail food establishments in Douglas County? That includes restaurants, convenience stores, and grocery stores. Now, you may be wondering what that has to do with tonight's live town hall topic. Well, stick around. We'll tell you about the role your health department plays in your favorite restaurant. We want this live town hall to be very interactive. We want to hear your questions. If you're joining us on the phone, press *3 on your telephone keypad to ask a question. If you, for those of you joining us online, please submit your question and our moderator will read it out loud. For those of you with us here in the room, just raise your hand and we'll bring you the microphone so everyone in the room, online or on the phone, can hear your question. Commissioner Thomas, take us into it.
Thank you, Commissioner Teal, and thank you all for joining us tonight. Did you know that nearly 95% of Douglas County citizens have their own private health insurance? That has a distinct impact on the services that your new health department provides. 80% of services are related to consumer protection, like restaurant inspections. Tonight, we're going to explain our health department services and take your questions. And as we get started, I want to give an overview of our department's budget. Overall, we are saving $700,000 a year in taxpayer money over our previous annual contribution to Tri-County Health. The total budget of the new health department is $7.4 million. Of that, $4.5 million is from state or federal funding. $2 million is from the general fund, and $900,000 comes from service fees. Roger, let's get started.
All right, thank you, commissioners. Again, we want to hear from you tonight. So to ask a question on the phone, please press *3 on your keypad and you'll be transferred to an operator who will take down some basic information. Once the operator notes your information, you'll be returned to the call and can listen to our conversation tonight until it's your turn. Since we'd like to hear from as many folks as possible, we'll limit all speakers to only one question. Maybe we'll take two. We won't be too tight on that. When it's your turn, I'll call your name and ask you to repeat your question for our live audience. You can also submit your question online. And again, if you're here with us in the room, remember to raise your hand and we'll get the microphone to you. And it's important when you're speaking to use a microphone so everyone can hear your question. Back to you, Commissioner Teal.
Hey, thanks so much, Roger. So let's start with the question that came in online. Sam asked, I keep hearing Douglas County has a new health department. I have my own health insurance, so why would I need public health? Michael, I wonder if you can help us out with that one.
Sure. Thank you, Commissioner Teal. So the health departments in Colorado, not just this one, do a lot more things than personal health care. So Tri-County did a lot of clinical services because in Adams County and somewhat in Arapahoe, there's a big need for those clinical services. There's less need here. Fewer people were utilizing the services of Tri-County in their clinics. The biggest portion of services that people used of Tri-County were the environmental health services. So as the commissioners already mentioned, restaurant inspections, grocery store inspections, things like that. And we also do a lot of health outreach and health education to help people understand how they might live healthier lives and lifestyles. So there's a lot of things going on that protect your health. And I think I'll let Caitlin explain a little more about what our environmental health people do.
Thank you, Michael. As Michael mentioned, we inspect restaurants, grocery stores, food trucks. We also inspect child cares to ensure that they're mitigating disease spread within the childcare setting. We're excited to announce that we are going to start inspecting pools again to ensure that the chemicals are at a good level to kill bacteria. And we also inspect septic systems. That's one of the biggest things that we do, is ensure that they're appropriately installed according to regulation to protect the groundwater.
Yeah, thanks, Caitlin. I mean, One of the big concerns that we have heard from is from our restaurant owning community, from our restaurateurs. And then, I don't know, in my past life, actually pool inspections turned into an odd one in our some of our HOAs. So thanks so much. Commissioner Thomas, you want to take the next couple questions?
I certainly will. Thank you. So we have a phone question. Roger, are you ready?
Let's go. Daniel, you are up. Go ahead with your question. Well, that sounded to me like maybe Daniel changed his mind. So, Commissioner, how about a question that came in from Beth?
Okay. Beth has asked, this is for Caitlin. My child goes to a daycare center in Douglas County. How do you inspect those?
That's a great question. So we inspect childcares on a risk-based process. We look at how many children there are, what kind of services they provide, and the age of the children. Things like diaper changing are more high risk, so we make sure that we're in there more frequently. We go in there twice a year. Facilities that are just preschool age kids, they don't do any diaper changing. We might go in there once a year or every other year. And we essentially just provide our approval to the Colorado Department of Human Services so that they can license them.
Great, Caitlin. Thank you. And we have another question that I think is for you to answer. Andrea says, I'm a real estate agent and sometimes I have to deal with septic tank inspections. Where do I get information about septic tanks?
Another great question. All of our information on septic tanks is available on our website at douglas.co.us. You can also give us a call anytime with any questions you have at 303-643-2400.
That's great. Now, Douglas County, we all know, is one of the healthiest counties in the entire country. Right now, we're number 3. We want to provide resources and education so we can all be as healthy as we desire. That's why one area of focus is community health. Laura Larson is our Assistant Director of Community Health. Can you give us a bit of information about community health in Douglas County, please, Laura?
Absolutely, Commissioner. Thank you. I oftentimes say that when we talk about community health, we're really talking about relationships and partnerships, whether that's relationships with individuals, whether it's relationships with families, community organizations, or the community as a whole. Within our community health division, we have a few areas of responsibility. The first includes clinical services. So as Mr. Hill mentioned, clinical services, especially for individuals who are uninsured, is not a service that we're necessarily providing directly, but we are working with Stride Community Health Center, which is a federally qualified health center in the metro area who has a location in Parker. And they are doing all sorts of clinical services from immunizations to reproductive health visits and STI testing. We also have health education. And when you think of health education, I really want you to think about the fact that that includes awareness, information, and promotional programs that cover chronic disease prevention and management, fall prevention, substance misuse, suicide prevention, sexually transmitted infections and the prevention of those, as well as tobacco education and cessation. We also have a maternal child health program that just launched in January, and that's really taking a look at the health of pregnant women, postpartum women and their families, and of course the kiddos. We will be taking a special look at individuals that have children and youth with special healthcare needs in the first half of this year to really determine what kind of access and barriers and gaps in care that we may have here in the county. We also have a nurse support program. That program is specifically in partnership with the Department of Human Services Child Welfare Program. So the child welfare team makes referrals directly to our public health nurse, and that nurse goes in and can do assessments with families. She can provide education, some prevention-related material, and connection to additional resources or referrals that those families may need to be successful. And lastly, we have the Special Supplemental Nutrition Program for Women, Infants, and Children. That's known as WIC. You may have heard of that program before. It is a nutritional program that supports pregnant women, breastfeeding women with kiddos under the age of 1, and children that are under the age of 5 who qualify for the program. So we have a lot of things going on in community health that are really here to help families and children thrive.
Thank you, Laura. Is there also a newsletter, and how can people get that newsletter?
Absolutely. So we just launched a quarterly newsletter for the health department here this week. You can go directly to Douglas County's website, douglas.co.us. And at the very bottom of that page, there is a subscribe link. You'll see it in a little green ribbon on the bottom of the page. You can also access that from the health department's website as well.
Perfect. Thank you, Laura. Now, before I turn this call back over to Commissioner Teal, who also serves on the Board of Health along with me, I just want to remind everyone to press *3 on your keypad if you would like to ask a question. You can also participate online by going to douglas.co.us/town hall. Commissioner Teal?
Hey, thanks, Laura. We do want to take a phone question, but before we do that, I just want to remind everybody, for those of you here in the room, if you do have a question or a comment, we invite you to raise your hand and we'll bring the microphone over to you. In the meantime, Roger, I think we have somebody on the phone.
We do indeed. Let's hear from Doug. Go ahead, Doug. You're live.
Go ahead.
I
Doug.
want to know how homeless people in Douglas County are able to access community health services from you all.
Not a bad question. Hey, Laura, would you like to field that one? Well, let's have Mike field that one.
Yeah, I mean, realizing that homeless might be more transportation challenged than others, the services are available in our county. They can go to the Stride Community Health Center just as any other resident could. There's more services available there than Tri-County's been providing here for the last few years. So there are some mental health and substance abuse services there that are available along with the immunizations. And they can work into primary care with the community health center if they need that.
All right. Thank you, Mike. Roger, do we have a question that came in online?
We do. Renata asks, how will the Douglas County Health Department support residents struggling with unmet mental health needs?
Definitely a good one. Who on the panel would like to take that one? Thank you, Laura.
So a few things for you all to be aware of. We do have the Douglas County Mental Health Initiative here in the county that's been doing some really incredible work around behavioral health conditions for a number of years. We've got a lot of focus right now on suicide prevention and substance misuse, and there's a great partnership forming between the health department and the Mental Health Initiative to ensure that we're really pushing forward priorities around those specific conditions. Certainly, we're continuing to look at our partnerships, whether that's with All Health Network, some of our both outpatient and inpatient treatment facilities that we have within or outside of Douglas County as resources as well. So we continue to look at that. There's also a community response team that is part of the Mental Health Initiative that is going out and actively working from a law enforcement and a behavioral health side to address the needs of people who are in crisis in that moment. And a lot of that is really to try and redirect those needs out of the ER, out of the jail systems, and meet those people where they're at and get them connected to resources. So we're definitely doing a lot of work right now around that, but certainly always open to feedback and suggestions if folks have things that they would like to share with us to help improve that.
I'd just like to reinforce everything that Laura just said about mental health in Douglas County. We launched our first community response team in Douglas County in May of 2017. Our suicide numbers dropped in 2019 and 2020. And I really believe, having been the former coroner who's been watching suicide in this county for years, that our community response teams really had a lot to do with the number of suicide deaths dropping. So Douglas County is on the cutting edge when it comes to mental health services, and we will have 9 community response teams, 2 completely dedicated to children in school by the end of this year. So just know that if you have a mental health need, we have a very broad program in Douglas County that can help you. Roger, I think you have a call online. And again, if you want to call in, *3 on your telephone keypad. Roger?
Let's hear from Robin next. Go ahead.
Well, good evening. I wanted to know who's overseeing our hospitals within our county because we've had some severe problems with them.
Go ahead and take that one. The Health Facilities Division of the Colorado Department of Public Health and Environment oversees all health facilities within the county and the state. That includes both hospitals and assisted living facilities, skilled nursing facilities. So any complaints, any concerns you have need to be directed to the Colorado Department of Public Health and Environment. And we are always happy to provide their information to anybody within the county.
Thank you, Caitlin. And I think Roger has another online question.
You bet. This one came in from Holly. She asks, will you have someone that will support and offer resources for employer groups? We had worked with Tri-County Health previously and received support around lactation support and health screenings.
So Roger, I'll answer that one. We are working with certain partners in the community around that. So although we're not providing any kind of breastfeeding support programs currently, we do have a partnership with Arapahoe County Public Health with their breastfeeding support program. We do have team members on our WIC team that are breastfeeding and lactation consultants. And so we can certainly work with folks that need that as well. As far as things like immunizations, we've certainly had some folks ask recently about immunizations for businesses. That is something that we're referring over to Stride Community Health Center to help support as well. So if there are needs as far as healthcare screenings, things like that go, please reach out. You can email us at h@douglas.co.us. Those emails come to me and the community health team, and we would be happy to get you connected to the folks that can provide those resources.
So again, *3 to reach out to us with your call. Roger, do you have another online question?
Barbara asks, since there are over 18,000 Douglas County residents that don't have health insurance in the county, I'm wondering what health services are not available to them now that we're available under Tri-County Health. What services are not available now that we're available under Tri-County Health?
So I think that's a really good question. And Mr. Hill addressed that Stride is actually providing more services and resources than Tri-County Health did as far as clinical services goes. As a federally qualified health center, the primary populations that they work with on a regular basis are individuals who are uninsured and those who are on public health insurance that don't always have access to private practitioners in the community. So whether that's basic things like immunizations, the sexually transmitted infection testing, reproductive health services, any kind of chronic disease prevention that a person may need, things like mentation and mobility assessments for older adults. Those are all things that Stride Community Health Center has the ability to provide. They have at their Parker location a family practice provider, they have a geriatrician on board, they have a pediatric provider, and they also have behavioral health support there as well. So they're a wonderful partner. We're glad to be partnering with them and really making sure that those folks that don't historically have access to healthcare services have the ability to access high quality care at Stride.
Thank you, Laura. We had a online question come in a little earlier from Matt. And Caitlin, I think this one's going to be for you. How do restaurant inspections work, and how do you grade them?
That is a great question from Matt. Restaurant inspections are, again, risk-based. So we take into account what kind of food they're serving, how much of it they're serving, and how well they've done on previous inspections. However, we cannot grade restaurants. It's a statutory requirement that we not oversimplify the results of an inspection. So what we do is we do provide all of our inspections online, again, at douglas.co.us. And you can review all the violations they've had, and it delineates how severe that violation was. So again, we can't grade them, but we do provide the information of what we found at our restaurant inspections.
Awesome. Thank you, Caitlin. Roger, did we get another online question in?
We sure did. Lucille asked, is there an MD overseeing Douglas County Health? If so, will you listen to their recommendations, or will you set your own way, like on issues like COVID. It's a little jumbled on the screen. But basically, is there an MD overseeing the health department?
Yeah, our director of health, Mike Hill. Mike, you do not have an MD, but I think you got a good way to answer that question.
Yeah, thanks, Commissioner. All health departments are required to have a medical officer. So we contract with a medical officer part-time. He attends our leadership meetings. We participate with him in making decisions and take his advice. We don't provide any clinical services, so there's no need for direct medical oversight. There's no medical services to oversee. But we do take into account his input.
Great. Thank you, Mike. We had somebody submit a question earlier. This comes from Nick. Nick says, are you still monitoring and reporting COVID cases? What other diseases do you monitor and where can I find the data? Mike?
Thanks, Commissioner. So yeah, we being the state in this case are still monitoring COVID cases and positive COVID testing. And the state collects all that data. So, excuse me, we do not collect the data. Never really did. It's the state who collects all the data. Then we access data from them that we can use to report out to you. And all of that data is reflected on our website. And just to add to what's been said before, it's douglas.co.us/health-department to get directly to us without having to search through a few menus.
Awesome. Thank you, Mike. Just want to take a moment to remind everyone that if you're joining us on the phone and you want to ask a question or make a comment, please press *3 on your keypad. And if you are joining us online, you can also participate at douglas.co.us/town hall. Well, Roger, did I see that somebody actually hit *3? And do we have a phone question?
We did, and it's easy to hit *3. So if you're listening, now's the time to jump in line. Kristen is next. Commissioners, here she is. Go ahead.
Hi, are you there?
You bet, Kristen. Go ahead.
It's Krista, but I was trying to see if Tri-County is trying to get more support from the community.
Oh, that's a good question. In terms of Tri-County Health Department, you know, Krista, they formally dissolved on January 1st, and they are an organization in receivership. So no, ma'am, I do not believe they're trying to get support from the local community at this time. And Roger, do you have an online question for us?
We sure do. This one came in from Karen. Has the county finalized any policy regarding gray water release dumping? And will the health department get involved with oversight as with septic systems?
Yeah, Caitlin, do you want to kind of take that one? And I've done a little bit of work on gray water, and so I can probably add a little bit as well. But why don't you address that part of the question as asked?
Yeah, absolutely. So we are involved. Currently, the gray water regulation is being revised, and we are taking part in that stakeholder process. We're working closely with the building department and Commissioner Teal on how that can be implemented within both the town of Castle Rock and the county as a whole.
Yeah, right now, the county is a part of a pilot program on the north end of Castle Rock, but in unincorporated Douglas County, in the South Canyons neighborhood, they are provided water by the town of Castle Rock per agreement, and they are a neighborhood who is participating in in-home gray water use, and that pilot program is underway as we speak. Commissioner Thomas, why don't you take it away?
Thank you. And so earlier this evening, Kimberly sent in a question. Michael, I'm going to have you answer this. She wants to know, if my child gets bitten by something, do I need to report it? And where do I do that?
Thanks, Commissioner. Yeah, you definitely want to report if your child gets bitten specifically by any mammals like dogs, cats, skunks, raccoons, whatever else you might run into because of the risk of rabies. Rabies is a very serious and 99.9% incurable condition. So it's important that you report those bites so they can be investigated and determine whether any post-exposure prophylaxis is in order. And you can report those on our website, again, at douglas.co.us/health-department.
Thank you, Mike. Somebody hit *3 and we have a question in the back. Roger.
Well, they submitted it online, which is just as good. So let's take it from Tony. He asks, are there plans to have a VA outpatient clinic in Castle Rock?
Actually, if it's okay, I can jump in on that one because I don't know that that's something that we've really been running through the Board of Health or the Health Department. But yeah, there has existed with the Veterans Administration plans to open up a VA outpatient clinic here in Castle Rock. The VA federal process is an extensive one. So I would love to tell you exactly where it's going to go in and when it's going to open. As a veteran myself, I would love to be one of the first people to walk through that door. But that has not yet been determined by the VA. It is something that we here in the Veterans Services Department are keeping an eye on. And I can assure you, it is something that we will be addressing as soon as we get more details. And you could probably look to me to be the first one to talk about it. We did get in a question earlier from Katie. Question is, will there still be WIC and that's WIC, WIC, and public health clinics in Douglas County? Michael, we've talked a lot about that with the Board of Health. Can you give us more details there?
Sure. Thanks, Commissioner. So, I mean, we've already discussed that we're not going to have our own clinics, that we're outsourcing those to Stride Community Health Center. But our WIC program is probably going to be more robust than when Tri-County was here. We will be providing services in the same 2 locations that Tri-County provided in our county. We will also be visiting Human Services and Elbert County because we are officially the WIC program for Elbert County as well. So we're going to be going closer to people rather than making them come to us. So WIC should be even enhanced in our new health department.
Great. Thank you, Mike. Sam called in earlier and asked a question. Sam says, injury prevention was mentioned as a top health department priority. What is the department doing to prevent injuries? Laura.
Commissioner Thomas. If you aren't familiar with our public health improvement plan, I would certainly encourage you to take a look at it. It is on the health department's website online. But that identified specific public health priorities that we will be continuing to work towards between now and the end of 2026. And injury prevention was one of those priority areas for us. And so we're engaging in a lot of different work as far as injury prevention goes. That includes motor vehicle accidents, whether that's distracted driving or driving under intoxication. It includes fall prevention in older adults. We're looking at suicide prevention and general substance misuse and overdose as well. So there are a lot of things that will be coming out of that particular priority area. Where we're going to start right now is with the strategic planning process here in 2023 so that we can identify some of the priorities that we want to work towards here this year and what are more long-range goals between 24 and 26. But part of that strategic planning process and part of our prioritization will include things like reviewing data, engaging stakeholders, whether that's individuals, community partners, it could be families, school district, et cetera, to provide some feedback to us as well so that we can really create some good educational programming with our community health educators that will support how we can prevent injuries here in the county. We're also working on a lot of partnerships right now. So we're working on partnerships with the school district, with the sheriff's office, with South Metro Fire and Rescue, and other organizations that are aligned behind injury prevention priorities. What we don't want to do is do duplicative work in the county. That's a lot of time and effort that's spent, that when we can come together, collaborate, and create unified messaging, we're pushing out the same materials to all community members that is consistent. That's just smarter as far as our work goes. We also mentioned earlier, but I just want to say it again, that there is a very strong emphasis on suicide prevention in the county right now. And that partnership between the Mental Health Initiative and the Health Department really is a priority for us. We just released in the last week a grant opportunity around suicide prevention. Within that grant, that is for community organizations here in the county who are doing really great work with prevention programs, central to suicide prevention, but also focused specifically on adolescents, pregnant women, middle-aged men, and older adults. So there's so much work going on in that arena, and is really just a focal point for us as far as prevention goes.
Well, awesome. Thank you, Laura Larson, very much. Great questions so far, everybody. Now, folks, we're coming to the bottom of the hour, about halfway through this evening. If you've just joined us or you joined us a little late, good evening. And thank you for joining tonight's live town hall about the new health department. If you're joining us on the phone, please press *3 on your telephone keypad if you'd like to make a statement or ask a question. And then anybody who's joined us online, you can also participate by submitting a question or a comment at douglas.co.us at / town hall. Let me try that again. douglas.co.us / town hall. Roger, do we have anybody on the phone for a question?
We do. Steve pressed *3, and he is up live next. Go ahead, Steve.
Thank you. Thanks for taking the call. Listen, I live down in Perry Park area, and I know this may not be a strict health-related issue, but for quite some time, actually several years now, right in front of Larkspur Elementary School, a Douglas County placarded tanker pulls up, about 5,000 gallons, fills up with potable water. And our water prices have gone up precipitously, no pun intended, out here in the area that's serviced by Perry Park Water and Sewer. So the county is taking fresh water, and I understand it just gets poured on the ground. I'd just like to hear your comments on that. It would seem to me that use for that water, which is non-potable after it's put in the tanker, that would seem to me that that's a gray water use. Fresh water should not be pumped out of the ground, treated, put into a tanker, and then thrown on the ground.
Okay. Hey, thanks, Steve. That's actually a super interesting question. So the way that a lot of water districts that work is they do offer wholesale licenses for wholesale use of water. And that water could be used in grading, dust mitigation, either on our roads or actually in other areas of development. If it was a Douglas County truck, I would suspect that that's being used for dust control on some of our gravel roads. Don't know the specifics, but that is a common thing that happens, and it usually occurs under a license agreement with that water district. The town of Castle Rock with their water district, Parker Water District, and then of course Perry Park has its own water district that may be participating just the same way that Castle Rock and Parker do. But let's turn, Caitlin, I wonder if you could help out with that second part of that question of if potable water, let's say from a well, or even from a municipal water system, is then put into a truck in that manner, does that really qualify that water as gray water?
That is a really good question. Technically, gray water is water that is no longer potable, but is also not black water. So it doesn't have human species in it, for example. So technically, yes, it becomes gray water at that point, I would say. However, I think that the main point of the question is more that could we use gray water for that? And the answer is not at this time. The way the regulation is written is that the water that is gray water from a house, for example, your laundry water or perhaps your shower water, for it to be dumped outside of the house and not into a sewer, it has to be treated, one, and it can only be applied in certain situations per the regulation. So just wanted to clarify that as well. We can't just take gray water and put it wherever we want to. We have to ensure it's appropriately treated and apply it in the manner that's set forth in the regulation that is a CDPHE regulation. So hope that thoroughly answers it.
But I think based on what I know about the regulation, Caitlin, I think you really hit it right on the head. That gray water is a very specific level of treatment, not to the potable level. So thanks a lot, Caitlin. We did get a question in earlier from Samantha, and she asked, where can I get a copy of my child's birth certificate? Steve, we haven't had you up to bat a whole lot. Can you take that one for us?
Thank you, Commissioner. Great question, Samantha. Yes, to receive a certificate, come visit us. We're here in Castle Rock, 401 South Wilcox. We're available Monday through Friday, 8:30 to 4:30. If you come and pay us a visit directly, we can have that certificate issued to you within 10 to 15 minutes. The first certificate is $20. Any additional one after that is $13. Another place that you can also go into is our health department website. Go into Vital Records. And of course, we've also partnered with Vital Check and GoCert. So there are different options to receive your birth certificate.
So from personal experience, I just want to let you know how incredible our health department is in providing birth or death certificates. So I've had the opportunity to go down to the state health department, and I have to wait in line. It's a long time. Now you actually have to make an appointment if you want to go to the state health department to get a birth or a death certificate. Last year, I had to get some certificates for my mom, and I went in, and Talitha and Katrina were so helpful. The certificates weren't ready yet, so they said, we'll take your name and number like we do for anyone else. We'll watch for it, and as soon as it is available from the coroner's office, we'll call you and you can pick it up. And that's exactly what they did. It was quick. It was easy. So if you are anywhere in the state of Colorado and you need to get a Colorado birth or death certificate, come to 410 South Wilcox and you will get Cadillac style service.
Commissioner, I was told back here that that's the Vital Statistics is the number one hit on the county's health department website. So.
Well, I'm not surprised by that because that's something that people need every day. You want to get a driver's license and you can't find your birth certificate. Don't waste time looking for it. Just go to 410 South Wilcox and they'll help you out. Okay, Derek wants to know how much the new health department is costing taxpayers. And we know for those of us who have been on this journey since 2020 that the cost has been a huge question. Here in the hearing room, we were, as commissioners, were accused of going to cost $10 million of general fund money to create our new health department. So, Michael, this one's all yours.
Thanks, Commissioner. And working with the Board of Health, we decided to design this health department to fit what's needed in Douglas County. When we did that, we didn't start out trying to build a cheap health department, or I didn't anyway, but I decided to do it as economically as possible. So we're not providing any more services than our community has asked for. We're not, we're providing Cadillac services maybe, but I would argue on a Volkswagen price. So we've done, I think, a good job of being stewards of the taxpayers' money. So the taxpayers of Douglas County will save around $700,000 a year compared to what it costs to run the Tri-County Health Department, or our contribution to running Tri-County Health Department. And I honestly think I might bring the budget in even a little bit better than that. That's just what we're currently budgeted as.
Well, and I'll jump in there and just remind everybody the $700,000 savings that we were able to realize last year, that's with a startup of a department. Any of you who have ever been involved in a business startup, you usually have some of your higher costs up front. I know that was my experience in business. So I've been really satisfied. I've been really very happy with how our budget did work out over this last year. And hey, Mike, if you want to save the people of Douglas County more money, you just go right ahead, buddy. No problem. moving along, I think we do. Roger, do we have an online question?
We sure do. This one came in from Ismail. They ask, what are the plans for investigation and surveillance of viral and other environmental pathogens?
Would that be a good one for John to pick up, or Mike? Would you like to assign that somewhere else? Well, then, John, Caitlin, why don't you take it first, and John, you can bat clean up.
All right, I'll start with environmental concerns. So obviously, I work very closely with John. John oversees both emergency preparedness and response, as well as communicable disease surveillance. And so we work very closely with epidemiologists to ensure that we're not seeing sudden spikes of diseases within the county. So those diseases can be both environmental and viral bacterial. And we work together to address those outbreaks and help mitigate. So if it's something happening in a regulated facility, for example, a restaurant or childcare, us environmental health staff go out and we do an inspection and we see what we can do to help prevent the spread continuing. And we take our epidemiologists with us and work very closely with them with their expertise to help make sure nobody else is getting sick from that situation. And John, you can take it from there.
Thank you. As Caitlin said, we work closely to identify trends and to stay in front of the things that are happening and monitor and investigate. We do surveillance as well as investigation, with the idea being to limit the expanse of whatever the threat is, to identify and limit the expansion of whatever it is. It's very important to, as quickly as possible, identify a problem has occurred. And that's why the collaboration is so important, whether it be foodborne or environmental. So what we do requires a great deal of communication and collaboration with both within the health department and within the health community, the hospitals, emergency management, and other partners. So there's an awful lot of coordination and collaboration that's involved in order to effectively identify what's going on and make informed decisions as to how to best intercept and eradicate or stop the spread.
Cool. Thank you, John. Thank you, Caitlin. So we had a question submitted earlier that I think actually is really close to that, but then gets a little more specific. It's from Sarah. She asked, she stated, disease prevention was cited as a top priority for our community in the Public Health Improvement Plan. Her question is, what is our most common chronic disease in Douglas County, and what is the department doing about it?
Great question there, Commissioner. There are a few different chronic diseases that we're really looking closely at that were identified in the Public Health Improvement Plan, and I actually just went and pulled some current data on it as well. So the first is going to be heart disease, and I share this one first because February is Heart Month. You're actually going to see a lot of preventative information coming from us on our website, on social media channels, specifically about heart health. So that includes high blood pressure, also known as hypertension, as well as high cholesterol. Currently in the county, when we look at hypertension, the hypertension rate in adults is 24%. The average in Colorado is 25.8%. So we fall right in alignment with what the state averages are, but it's definitely been identified as a priority. Same thing with high cholesterol levels in adults. That is an average of 31.7% here in Douglas County, and in the state, it's 31.3%. So we're very much in alignment with what averages are, but they're important pieces as far as chronic health conditions go that we should be paying attention to. Another area is overweight adults and obesity. And so this is something where we see over 50% of adults here in the county are identified as either overweight or obese. We don't see that same rate in children. The rates of obesity and overweight kiddos is significantly lower. So the priority area here really is around adults. And so what does that look like for us? As far as our health education team goes, as we look at creating chronic disease prevention messaging and presentations, and handouts and things for community members to take access of. That will include healthy eating tips, physical activity. Obviously, Douglas County has a wealth of ways that we can be physically active here in our county with all of the things that we have outdoors. So that will also be a focal point for us. Diabetes has also been identified as something that is a priority as well. Previously, Tri-County did have a diabetes prevention program. That is not a program that we are providing directly. However, if residents are in need of diabetes prevention, diabetes self-management programs, we do have a partner that does that. That is Adams County Public Health. They actually do the state diabetes prevention program and are continuing to offer virtual classes for both diabetes prevention as well as self-management education programming. And all of that information is on the health department's website under community health, which you can access. The last piece that we're focused on with chronic disease prevention is actually skin cancer. What you may not know is that the skin cancer rate here in Douglas County is actually higher than the state average. So state average is 6.9%. We sit at 7.9%. So it is something where we're really taking a look at what does sun safety look like? We have to start that young. We need to start that with our kiddos, but it's very, very important for adults as well. So those are really where we're going to start on the chronic disease side. That's not to say there's not a lot more that we can be working on as well, but those are part of the public health improvement plan priorities that we'll be focusing on.
Thank you, Laura. That was a lot of good information. I'm surprised about the skin cancer information, so thank you for sharing that. Roger, I think you have a phone call from someone who did *3.
We do. Trudy, it's your turn. Go right ahead. You're live with our audience.
Oh, yes. Previously, you discussed how the health department is monitoring any new diseases, viruses, etc. How do you communicate this to the public in the event that you find something?
Trudy, hold on. We're just getting a mic up. Go ahead.
She's still on the line. Could she clarify? No, she can't. Okay. Depending on how we're notified of the event, the illness, or really kind of defines how we follow up. For example, with the COVID, the RSV, the flu, we get notified through the state that someone has sought treatment and tested positive. And then we follow up with the patient, from that point on. We have various ways that we get notified, and based on the way we get notified, it predicates how our response is done. But then the EPI staff investigates, they find out the details, and they also help direct the person to the appropriate follow-up care if that's necessary. And we also then use that more in a macro to see if it's part of a trend. And if it is, then maybe we need to expand the investigation and make sure that we stop it sooner than later.
Now, John, I wonder, so if I'm just George Teal, living at 931 Eaglestone Drive, everything's great, I don't feel bad, but I see something on the news about a disease. I mean, let's look at the early days of the pandemic. And is there a place that we can go, just a regular citizen of the county, say our webpage, to see what diseases may be out there, what communicable diseases may be active? Do we have something like that?
The dashboard seeks to capture current and past events, where you could take a look and see what the trends are within the community, the hospitalization rates, and so forth. So you would be able to get a pretty good snapshot of what's going on if you were non-symptomatic. If you were symptomatic, then we would certainly encourage you to seek proper medical attention, and you might end up talking to us further on down the line. We also take calls and help people get guided in the right direction. The EPIs do that all the time, provide information to people, guidance, and help them seek the appropriate either treatment or assistance that they need.
Awesome. Thank you, John. Yeah, clear, something that was captured very early on by the Board of Health President, Doug Benevento, was we always want to make sure that we're providing the right information that just the average citizen of the county can use to make their best their best health decisions for themselves. Roger, did I see that we had an online question come in?
We sure do. Before I read the question, though, I was going to read a comment that came in from Karen. Karen says, excellent town hall. Just wanted to thank the commissioners and the health department officials for their efforts on behalf of Douglas County residents. It's always nice to hear a compliment in the
thank you,
line of
Karen.
business that you all are in.
Thank you, Karen.
All right,
We very much
Len,
appreciate it.
here's the question from Len. He asks, can you describe how Stride gets paid and how many residents have used them so far?
Yeah, so we have a contract with Stride that they make these services available to our residents. We've set up a phone line where they can call a number here and it gets directed to the correct people in Parker at Stride. So it's a pretty simple system. You know, as we stated earlier, I think we stated that there were not a lot of people in Douglas County utilizing the clinical services of Tri-County Health Department. So in December, we had 3 people utilize Stride services on our behalf. I suspect that's going to pick up once word gets out and people find out there's more available. For the last 3 years, the only clinical services provided by Tri-County in Douglas County were immunizations, period, nothing else. So you have more services available, and I think when people figure that out, our utilization will go up, but we have contracted for something on the order of $200,000 a year. I don't have the exact number in front of me for them to provide amped up staffing to be able to handle the extra workload that we might send their way.
And I believe Roger has an online question.
We do have one more. It's from Steve. How many total employees are there in the department?
Okay, so the Board of Health has approved for us to have a total of 41 positions. Right now, 35 of them, I think, are filled with people. We have one person, I think, starting next Monday. So we'll be at 35. We're still interviewing and hiring for a couple of positions. We're trying to be careful and bring on the right people so that we have a good team and we don't end up having disruptions in our midst, that we're all working together happily for Douglas County.
All right. Thank you, Mike. Well, folks, Mickey's Big Hand says that we're coming to the end of our hour together. So I'd just like to take a couple seconds to make a couple of comments. I hope everybody who's had an opportunity to both attend here in the room as well as follow us on the phone or online does have an appreciation for the team that we've been able to put together here in the county over the last year. Of course, we have a Board of Health that was sat. We made the hiring of Michael Hill as our public health director. And of course, and we actually have one of our alternates for our Board of Health here in the audience today, as well as Commissioner Thomas and myself who sit on the Board of Health. Early on, we wanted to have the focus that the health department was going to be the provider of the basic services that we as Americans, we as Coloradans depend on here in our society. Many of you who know me know I'm a big history geek. We have had epidemics in our nation's history, whole cities that were ravaged by communicable diseases. We've gotten away from that time, but now those are still tasks to ensure our public health that still remain. And that's what we're going to be focused on. And at the same time, giving you the information you need to make the very best health decisions for you and your family as you live the life you want to live right here in Douglas County. Thank you all for joining us this evening. Commissioner Thomas, would you like to take us out?
Thank you, Commissioner Teal. You know, the purpose of tonight's live town hall was to make sure the public knows that Douglas County has succeeded in having a public health department that in some ways even exceeds what was available through Tri-County Health. When I made the motion to leave Tri-County Health in July of 2020, I knew that this county could get it done. And we weathered lots of comments from citizens that we were going to kill people by leaving Tri-County Health. We have done a good job getting those services in place. And I would just like to reflect on a question we heard about birth certificates. So if you need a birth or a death certificate, they are easily available here in Douglas County in Castle Rock. We heard Laura Larson talk about motor vehicle deaths and prevention. There is a state program called the State Emergency Medical Trauma Advisory Council. Excuse me, that's a governor appointee. I'm on that council, and I also serve as the chair of the Semtech Prevention Board. Last week, we heard that the State Patrol is very concerned about motor vehicle deaths. There are almost 800 for 2022. That is one of the highest numbers in many, many years. The numbers are going up, and the State Patrol and CDOT are going to be doing a press conference soon and starting a campaign to notify people we need to start being safe on the roads again, because these are lives that we can save. And I imagine that our health department is going to be messaging about motor vehicle deaths and fatalities as well. So thank you for joining us. I really hope that listening to us and the great people that Mike Hill has put together in our Douglas Health Department have shown you that we are absolutely ready and able to provide the services that are required through public health. Thank you for all being here. Good night. And if you need our health department, we are here for you. Thank you.
Thank you, Commissioners. On behalf of Douglas County, thank you for joining us this evening. If we didn't get to your question tonight, we invite you to submit any questions on this or any topic to douglas.co.us/Citizen Connect. We hope you'll join us again at a future town hall. In fact, next Wednesday, we'll be talking about short-term rentals. So join us then. And on behalf of everyone on the panel tonight, good night.